I'm Dr. Joe Massad and
Dr. David Little.
And we actually just finished doing implant surgery. David did a wonderful job, and I'd like for him to explain how we utilized a new laser, LiteTouch Laser. How we utilized a new laser called LiteTouch, and how we utilize this in our implant surgery. David.
Well, great. And we planned this case out using all the technology, and we used a pilot guide. So one of the great things about this is I was able to take the thin tip, place it through the pilot guide, and just mark where I needed my opening to be. Then I could remove the guide, and then using the LiteTouch laser, I was able to make access. So I made a beautiful hole. I had no bleeding, very clean cut. It was very easy to access. It feels just like a handpiece, and it is a touch laser, so it went really smoothly. And as you'll see from the videos, you'll see that there was just no bleeding, and it's also sterilizing at the same time. So once I did that, then I was able to place the implants. Then when I placed the abutments on, I went back and went around and just cleaned everything up very nicely, so that now it's going to heal better with no stitches. The patient's going to heal quicker. And then Dr. Massad's going to do the restorative, so now he's going to be able to just go ahead and go straight to the restorative, and it'll be healed up nicely around those implants.
And I think one thing that was nice is that it has its own air and water supply, and so you can actually gauge the stream, and I think that was very important.
And the other thing that, as I was doing it, I could actually alter the amount of water. Okay, I could lower it or make it higher, or the amount of energy. So at first I did a very conservative, and then as I saw exactly where I wanted to go, I went to a more energy and was able to do it faster. And so it gives you that complete control of how you want to make your access.
Now, did you use this to start the pilot hole? In other words, did you use a reamer or what?
Now, that's one great thing about this is it's a soft tissue and a hard tissue laser. So I could have changed and gone to a hard tissue and actually did the osteotomy with the laser as well. Okay, in this case we didn't do that, but we can do that with this instrument.
So it has pluses over about anything we've actually seen. Now tell me, why wouldn't you just use a Picasso, the smaller one? It's a great Picasso.
And I have Picassos too, and it's a great instrument. Okay, I think this is obviously going to do it faster and a little more efficient than that too. And also the being able to do more things with it. For example, being able to do hard tissue and soft tissue, being able to, with implants, be able to do the osteotomy. Or let's say we're not doing implants, do a little bit of soft tissue crown lengthening and hard tissue crown lengthening. So it gives you that advantage.
How about caries removal?
And caries removal. So being able to go in and do caries removal and without anesthetic, patients really like that, and being able to do it very conservatively as well. So it gives you a lot of options, and that's one of the things I like about this technology.
Now, this is not a CO2. What is this?
No, this is an erbium YAG laser.
Okay,
not a CO2 laser.
So the wavelength is somewhat different.
Even though you can do both hard and soft tissue, okay, whereas CO2 is more just for soft tissue, this gives you the ability to do both.
So we just wanted to let you know our experience was very good today. And of course, we both experienced the first generation, which was just the soft tissue, and now we're getting into the next step, and hopefully it's going to be something that really sweeps the nation, and cost-wise, it seems to be about half about anything else.
Yeah, it's very affordable, and the other thing too is when I want things in my office, they're going to be better for my patient and be more efficient, and that's what this allows us to do. One of the other things, Joe, that's great, if you look at it's all touch screen, so you're able to do that. But the other thing that's great is it all has presets. So it has the presets for if you're going to use hard or soft, and it's all the gentle settings, and then you can alter it from there on what you want. But it's easy, and you can have your staff preset it up before you go in there.
And you can actually go onto the screen and set your particular preferences, because they're going to be maybe a little bit different than mine. So other dentists in my office may want to use this for doing cavity preparations and so forth and composites, but for crown bridge, it's very good also, but now we're using in an aspect for implants. So I think it has multiple uses. I would like to say one thing. This is an unsolicited recommendation that we're giving. No one has asked us to do anything. no one has paid us to do anything, so I just think, is that correct?
We talk about what we use.
That's right.
So.
We like it, we use it, we talk about it. Otherwise, we don't talk about it.